everyone. So my little dog has a skin condition and the veterinarian recommended a shampoo that of course they sell, a medicated shampoo, but I have to wash the dog now twice a week. This little white dog usually gets washed once a week. She's shaking because she knows it's bath time. The thing is, the medicated shampoo cannot get on her face or her ears. So when I start the bath, I use her regular shampoo, which I love this. I've been using this since she was a puppy. It's the BioGroom No Tears formula. The blue is for little white dogs. So I do her face and her legs in that. And then rinse her off, and then I use the medicated shampoo. Now the thing about this medicated shampoo is that the first ingredient listed, or active ingredient, is benzoyl peroxide. And if you remember from using acne type acne type products on your face that has benzoyl peroxide, if you get that on a towel, it'll take the color right out. So that's why I'm wearing an old shirt that I usually wear to paint in on top of my clothes, and yeah, so I make sure I don't get this on myself. After lathering up the dog's back, basically her body, she has to leave it on for 10 minutes. Oh, she isn't happy. So what we do is, she eats canned dog food, so I time it with her meal, and I have her canned dog food. She can smell it. She was looking for it actually. And I take the spoon and I smush it around the sides, because otherwise if it's too easy for her to eat, she'll gobble it up in 2 or 3 minutes and then look at me like, why am I still in the tub, and try to get out. She's 14, I don't like her getting out of the tub in the middle of winter. So I smush the food around the edges and around the bottom, so it takes her a little longer. But you know, once she's lathered up, I have my phone with me, pull up the timer app, set it for 10 minutes and let it rip, and I sit and read, and then once she's finished with her food, I try to keep her in the tub. I'm going to use about this much. She had what started as warts when she started getting older, and then they started getting scabby, and she's losing hair, and oh my goodness. So she actually has them, let me see make sure we get in the camera shot here. She has them on top of her head too, so I'll put them there, but just not on her ears. So they're these little scabby things, and anyway. So here's the lather. Now it's time to set the clock for a 10-minute countdown, and I'm going to give her her food. Hi, baby. Stay in the tub. No. Stay in the tub. You have 4 minutes and 15 seconds. In the tub. Get down. Get down. Good girl. No. Cookie. Stay in the tub, Missy. In the tub. No. Stay. No. 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 Oh, stay in the tub. Thank you. I see you. I know you're done with your dinner. Lick the empty bowl a little more. What? Bless you. Shake, shake. Lick the empty bowl. Oh. Oh. Stay. Do not get out of the tub. Stay. Stay in the tub. Stay in the tub. Oh. Bless you. Oh. 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 You have 2 minutes and 45 seconds. Oh. Oh. Oh, I know. Oh, stay in the tub. Oh. Ah. Oh. Get in the tub. Stay. Oh, stay in the tub. Whoa. I know. The 10 minutes are blessedly over, and now I rinse the dog off. I had that little bit on top of her head. Just don't want to get it in her eyes. She does not like to get her face wet. And then I use a cream rinse that I've been using on her for a long time. I give her a little squeegee. And this is also the BioGroom, let's see if I can look at the BioGroom Silk. It's a nice cream rinse for dogs like her who have longer hair. And she's been using these BioGroom products ever since she was a puppy. So it's not the products, it's something else going on in her system that's creating this skin. The last thing I use for the dog is this Odie Soothe in her ears that I also got from the vet. If the dogs like mine, they get water in their ears and then it can cause an infection. So you put a couple drops of this in and it actually dries out the ears. So let's see if she'll let me do it in front of the camera. Got your bite. Oh, great. Well, we're bloody right now a little bit, aren't you? Rub it in and then she'll shake. All right. And she's got something going on. She's getting some blood on the rug here because she's got a little sore in her head with the bath opened up. So now these are going to go in the wash. Cookie! Cookie! Woohoo! Hi, baby! I found a great way to get my little dog to take her medication, especially when the med is in pill form. And this is a great method, especially if your dog is small. Those little dogs, they don't like to swallow big pills. So